Hey everyone, it's Laura with Naps. Today I want to talk to you about a very common anxiety that comes up for people who are having their first babies. That is tears and episiotomies during the labor and delivery process. Now, tearing is incredibly common, especially if this is your first vaginal delivery. It happens in about 50 to 80% of deliveries. Most tears are small and heal beautifully with really good aftercare. An episiotomy, on the other hand, is when your provider will discuss with you the option of making a small cut in your perineum in order to get the baby to be born faster. Episiotomies are usually happening in an urgent or emergent situation. Episiotomies are not routine practice. If you tear, ice packs are the first thing that you're going to want to use in the postpartum period. Apply an ice pack to your perineum every time you change your pad, especially in the first 24 hours. That's going to help reduce the swelling in your perineal area. The next is sitz baths. These are going to help bring some nice warmth and blood flow to the perineal area, expediting your healing process. You're also going to want to use a peri bottle filled with warm water. Use this especially when you pee, and especially if you have stitches. This is going to help reduce the stinging that you might feel during that process. Rest and slow, gentle movement are also incredibly important in the postpartum period to help any sort of tear or episiotomy that you had heal a little bit faster. So while tearing is very common during vaginal delivery, with the correct postpartum care, you're going to be healed in no time.